Hi, I'm Autumn Sanderson, and this is video 4 of my gold standards for COPD exacerbations video. And in this video, we are going to be talking about rehab, education, and self-management. So an overview of our video, we're going to touch on pulmonary rehab, symptom control, oxygen therapy and ventilatory support, and surgical interventions. So what is pulmonary rehab? This is a program that educates patients using exercise to increase awareness about their lungs and their disease. It helps them cope with the chronic illness that they have, and it helps them improve their lung function and work out their breathing while in the program. But there's many other benefits to pulmonary rehab that patients get to experience, such as being in a group setting. A lot of patients with a COPD diagnosis kind of struggle with the diagnosis. So having a social group to go to, like-minded people who you're surrounded by, who are possibly going through the same sort of struggles that you're going through, can really help in the long run. It can also benefit patients by improving their exercise tolerance. A lot of the activities and exercises that patients do in pulmonary rehab are very similar to what some people might do at the gym. It's also a great way to better manage their chronic illness, especially if they are a newly diagnosed COPD patient. I think it's best to get a newly diagnosed COPD patient in a pulmonary rehab sooner rather than later, so that way they can develop healthy habits and find good ways to manage their diagnosis. This will also help to decrease the number of hospital stays because a lot of the things that we learn in pulmonary rehab are ways that we can prevent exacerbations and help better manage these diagnoses. So not only are we learning healthy habits like exercising, they're going to also educate you on a variety of various topics while you're in pulmonary rehab, including your dietary needs, how to eat healthy, also how to properly use your equipment and your tools, such as your inhaler and your spacer, or your various devices that you need to measure your peak flow or do bronchopulmonary hygiene. And of course, we're just going to improve our overall quality of life. I think that all of these various factors that go into pulmonary rehab combined, especially over a length of time, will significantly improve a patient's quality of life, not just physically, but also mentally. Symptom control. So patients can control their symptoms through various ways. A lot of these ways are very similar to how we are going to manage our symptoms, which we kind of previously touched on in another video, but we're going to go a little bit more in depth now. So not smoking. A lot of patients who are diagnosed with COPD, they may be chronic smokers. They may be people who have smoked for 50 years. They might be people, though, who haven't smoked that long. Either way, we want patients to stop smoking, and we're going to take all of the necessary steps to encourage them and support them to make sure that they can avoid that and not cause any further damage to their lungs. We're going to encourage them to attend regular checkups. Patients who see their doctors more regularly are less at risk for exacerbations because their doctors know that they are on the right regimen and medication plan for them. Patients can be educated even further just by going to their physician annually. Receiving necessary vaccines. We want to make sure that our COPD patients are getting their flu vaccines, their RSV vaccines, their COVID vaccines. There's actually a lot of research coming out that if you had COVID, even if you were not a smoker, you may have COPD now, or you are at a higher risk of developing COPD. So this could mean a lot of different things. But for our patients who have COPD, we want to make sure that they continue getting those COVID vaccinations so that they don't get a serious illness such as COVID or the flu or RSV. And because we don't want our patients to come down with a severe illness, have a horrible exacerbation, have to come to the hospital, and have to have extra measures taken to make sure that they are okay and healthy. Patients can also benefit from O2 therapy. So some patients might benefit from higher levels of oxygen than others. Again, this goes back to every patient's plan is not the same. So some patients are going to require higher levels of oxygen than other patients, but this could help control our symptoms, specifically that shortness of breath that a lot of COPD patients have. We want to make sure that we're taking our medications appropriately. That means appropriately using our inhalers, but also making sure that we're taking our SABAs or our SAMAs with our inhaled corticosteroids. We want to make sure that we are flushing our mouth out with water after taking the ICS. We want to make sure that we're taking our medications, the correct medications, when they are needed. Okay, so a short term medication for quick relief, or do we need to take our long acting medication for maintenance? So, making sure that we're taking those appropriately is going to be key in controlling those symptoms and keeping those exacerbations at bay. We also want to make sure that we're using proper technique, not only with our inhaler, but our bronchopulmonary hygiene technique. If we are using proper technique with that, then we are getting the best benefit out of it, and therefore expelling that sputum that is sitting in our lungs that could cause an exacerbation. We want to make sure that we're eating. So, not going to Taco Bell every day of the week, not ordering Papa John's every night. We want to get nice, good whole foods, eat a vegetable, drink some water, maybe exercise a little bit. So, we talked about pulmonary rehab. In pulmonary rehab, they actually teach a lot of really useful and helpful exercises that patients can use on their own. They don't have to just do these exercises in pulmonary rehab. So patients who are in pulmonary rehab can practice these exercises outside of pulmonary rehab, or when they're done with the program, they can continue to use these exercises. But even if you're not in pulmonary rehab, everybody can benefit just by getting up and moving around a little bit, even if that means just taking a short walk every day. Not living a sedentary lifestyle is going to help our overall health in the long run. And again, that kind of ties into this next point is just living a healthy lifestyle. Don't smoke, don't do drugs, don't drink alcohol, don't eat nothing but fast food, move your body, go to the doctor, do your things. All right, treating exacerbations. So, what can patients do if they have a COPD exacerbation? So, your short acting bronchodilator may help with quick relief. This is going to be your SABAs or your SAMAs. You want to follow your medication treatment plan. Don't up your medication dose just because you feel that that might help you with your exacerbation. Consult your doctor, talk to your healthcare provider, and make sure that you are taking your medications exactly how they have been prescribed to you. Oxygen therapy, using supplemental oxygen may help in a COPD exacerbation, especially if we're coughing a lot, we're short of breath. That can help us get those SpO2 levels at a good place. And then non-invasive ventilation at home if needed, especially if you are somebody who is hypercapnic or needs to blow off, a little bit of that CO2. That might also help you in the event of an exacerbation. Oxygen and ventilatory support. So, long term O2 therapy has been seen to be beneficial in a lot of COPD patients. Short term NPPV, long term NPPV, especially for, like I said, our patients who have chronic hypercapnia or patients who have a history of acute respiratory failure. If you are a patient who's had many exacerbations in the past and you've had to be hospitalized and put on invasive ventilation, then you know how horrible that acute respiratory failure is. We don't want that to happen. So, long term might be best for you and for that situation. Again, it goes back to what are the patient's symptoms, what is their lifestyle like, what's their history like. Your healthcare provider will help you form a nice, good management plan for you. And then, of course, invasive mechanical ventilation. If in the event that a patient is in respiratory failure, of course, this is going to be in a hospital setting. And then surgical interventions include a lung volume reduction surgery, an endoscopic lung volume reduction, and a lung transplant. These surgeries don't happen that often. Unfortunately, COPD is a condition, a chronic condition that a lot of people have. And unfortunately, it wears down on your body, especially the older that you get. You might not be stable enough for something as serious as a surgery or a lung transplant. So, prevention is going to be so, so important. And um, it's going to be important that we manage the COPD. As soon as we know that we're diagnosed with it, we want to manage it. We want to treat it as best as we can. We can't reverse it, but we can manage it and make sure that our exacerbations are limited the best that we can. So, in this presentation, we went over pulmonary rehab. We talked about how we can limit our exacerbations, what to do if a patient has an exacerbation, how they can manage those symptoms, the benefits of patients using oxygen and ventilatory support, and of course, these surgical interventions, though rare, definitely still options for those who qualify. And then those are my works cited.